Hello everyone and welcome to our video on common pediatric skin conditions in 5 minutes or less. Bacterial infections are fairly common in pediatrics and can occur anytime there's a break in the skin. The skin normally harbors bacteria, and the most pathogenic is either staph or strep. Impetigo is a perfect example of a bacterial infection of the skin. It starts as an itchy red rash that then becomes versicular and then gets honey-crusted yellow drainage on top. Most of the time, we can treat impetigo with just topical antibiotic ointment. However, sometimes oral antibiotics are necessary. If we think it's because of MRSA, we have to add vancomycin. The nursing care of impetigo includes emphasizing hand washing, minimizing the manipulation of the area to prevent spread. Contact dermatitis is an inflammatory or hypersensitivity reaction when your skin comes into contact with something that you either are allergic or irritated by. Poison ivy is a good example. However, there are many allergens and irritants, including soaps, detergents, dyes, perfumes, cosmetics, medications, or even plants. Contact dermatitis is characteristically a very itchy rash that has a sharp demarcation, and you can see where the skin came into contact with the substance. The first step in treatment is identifying and stopping exposure to the offending agent. You can use soothing topical treatments that are over the counter. Antihistamines also help with itching, such as Benadryl or Zyrtec. Topical steroid creams or even oral steroids can be helpful as well. Pediculosis capitis, or head lice, is another common parasitic infection in school-age children. Clinical manifestations of head lice include itching and observable nits. We treat head lice with medicated shampoos that are available over the counter. Nursing has an important role in the prevention of head lice. This includes education, as well as monitoring. Please pause the video to review these important home instructions for the parents of a child with head lice. The last condition we'll talk about today is atopic dermatitis, which is also referred to as eczema. There are many different kinds and categories of eczema, but they all relate back to chronic inflammation. Two examples of the types of eczema include infantile form and childhood form. The extremities are usually symmetrically involved in the child with eczema. You'll notice small red or flesh-colored papules that are scaly and dry and itchy. When you think about eczema, think about treating the inflammation or redness, as well as hydrating the skin. And remember, anytime there is a break in the skin, you have the potential for a secondary infection. The treatment of eczema includes a heavy moisturizer, as well as sometimes topical steroids to diminish the inflammation. These come in low, moderate, or high potencies, and we attempt to limit the exposure to topical steroids, especially high potency steroids, because of the side effects. Thank you.